Have you ever had a tiny cut that seemed to take forever to go away? Maybe it was a small nick from cooking, a scrape from gardening, or a little tear on the back of your hand after bumping into something. Nothing dramatic, nothing that looked serious. But days later, it was still red, still tender, still not quite closed, and you may have thought, well, I guess this is just what happens when you get older. Sometimes, yes, age does play a role. But after 60, a slow healing cut can also be your body's quiet way of saying that something deeper may deserve attention. Not panic, not fear, just attention, because healing is not just about the skin. It involves blood flow, blood sugar, immune response, nutrition, inflammation, and the body's ability to rebuild damaged tissue. When one part of that system slows down, even a small cut can linger longer than expected. Most of us do not think about healing until it changes. When we were younger, a scratch could disappear almost without effort. You washed it, maybe covered it, and a few days later it was gone. The body handled the repair work silently in the background. But wound healing is actually a remarkably coordinated process. First, the body tries to stop bleeding. Then immune cells move in to clean and protect the area. New tissue begins to form. Tiny blood vessels help deliver oxygen and nutrients. Over time, the skin strengthens and remodels itself. All of this happens automatically, but it does not happen magically. It requires good circulation. It requires enough nutrients. It requires a balanced immune response. It requires skin that still has enough strength and flexibility to repair itself well. And after 60, some of those systems may not work quite as quickly as they once did. The first thing to understand is that aging skin is different skin. As we get older, the skin tends to become thinner, drier, and more fragile. It may bruise more easily. It may tear more easily. The cushion of fat beneath the skin may decrease, leaving blood vessels and tissue with less protection than before. That is why a small bump that once left no mark may now leave a bruise. A scrape that once healed in a few days may now stay visible longer. This does not mean the body is failing. It means the skin has changed. But skin aging is only part of the story. One of the most important pieces of healing is circulation. A wound needs oxygen and nutrients delivered through the blood. It also needs immune cells to reach the area and help protect against infection. If blood flow is not as strong as it should be, healing may slow down. Think of it like trying to repair a road when the trucks carrying materials are delayed. The workers may be ready, but the supplies are not arriving fast enough. That is why circulation matters so much after 60. Poor circulation does not always announce itself loudly. It may show up gradually. Cold feet, leg heaviness, slower recovery, skin changes, or sometimes a wound that simply does not close as quickly as expected. Another major factor is blood sugar. Many people think of blood sugar only in terms of diabetes numbers, diet, or medication. But blood sugar can also affect healing. When diabetes is present, especially over many years, it can sometimes affect blood vessels and nerves. Blood flow may be reduced. Sensation may change. A person may not notice a small injury as quickly, especially on the feet. This is why doctors often take foot wounds seriously in people with diabetes or reduced sensation. A small cut on the foot may not feel painful at first, but if circulation is poor, or if infection begins, that small wound can become harder to heal. This does not mean that every slow healing cut means diabetes. It does not. But if wounds are repeatedly slow to heal, or if they happen along with other changes, blood sugar is one possible issue worth asking a doctor about. The immune system also changes with age. When the skin is injured, the immune system has to respond quickly and carefully. It must protect the wound without creating too much inflammation. It must help clean the area while allowing repair to begin. As we age, that response can become slower or less efficient. The body still heals, but the timing may change. The repair process may take longer to get organized. Inflammation may last longer than it used to. Tissue rebuilding may not move as quickly, so a wound that once disappeared in 3 or 4 days may now take longer to calm down. Nutrition is another part of healing that many people overlook. The body cannot rebuild tissue from nothing. It needs raw materials. Protein helps repair and rebuild tissue. Vitamins and minerals support normal immune function and skin repair. Overall, nutrition gives the body the energy it needs to do the work. After 60, it is common for appetite to change. Some people eat smaller meals. Some avoid certain foods because of digestion, dental issues, cost, or habit. Others may not realize they are getting less protein than before. Over time, small nutrition gaps can matter. This does not mean supplements are a cure. It does not mean everyone needs to start taking something new. But it does mean that slow healing can sometimes be a reason to look honestly at overall diet and discuss nutrition with a healthcare professional if needed. Then there is infection. Most small cuts heal without trouble. But if bacteria enter the wound, the body has more work to do. Instead of simply rebuilding tissue, it also has to fight infection. That can slow healing. It can also make the wound look worse instead of better. This is where paying attention matters. A healing wound should generally move in the right direction over time. Maybe slowly, but still improving. Less redness, less swelling, less tenderness, more closure. But if the wound starts moving in the wrong direction, that is different. Redness that spreads outward should not be ignored. Swelling that increases instead of decreases is worth noticing. Pain that gets worse instead of better matters. Drainage, pus, an unpleasant smell, fever, or red streaks near the wound are all reasons to contact a healthcare professional. This is especially important for anyone with diabetes, poor circulation, or reduced feeling in the feet. The goal here is not to make every small cut frightening. Most are not. The goal is to know the difference between a wound that is slowly healing and a wound that may need attention. There is also a common misconception that needs to be addressed. Many older adults believe that slow healing is simply unavoidable after 60. They think, this is just my age, nothing can be done, no point mentioning it. But that is not always the best way to think about it. Aging can slow healing, but it should not be used to explain everything automatically. If cuts are taking much longer than usual, if they keep reopening, if they become infected, or if they happen often, it is worth bringing up with a doctor. Not because it always means something serious, but because it may point to something that can be evaluated. Sometimes the issue may be circulation, sometimes blood sugar, sometimes skin fragility, sometimes nutrition, sometimes medication effects or an underlying condition. Sometimes it is a combination of several small factors. That is why one symptom should never be turned into one diagnosis. The body is more complex than that. So what can older adults do in a safe, practical way? Start by paying attention to your skin. Dry, fragile skin is easier to injure. Keeping skin moisturized and protected may help reduce cracks, tears, and irritation. Wearing gloves during gardening or chores can also reduce small injuries before they happen. Support circulation in ways that are appropriate for your health. Regular movement, even simple walking or gentle activity, can help maintain overall circulation. Of course, anyone with heart disease, severe pain, balance problems, or other medical conditions should follow their clinician's guidance. Think about nutrition as part of healing, not just weight. Meals that include enough protein and nutrient-rich foods give the body better building blocks for repair. If appetite is low, weight is dropping, or meals have become very limited, that is worth discussing with a healthcare provider. For people with diabetes, foot awareness is especially important. Checking the feet regularly, noticing small wounds early, and getting medical advice when something is not healing can make a meaningful difference. And if you take medications or supplements, do not change them on your own because of a wound. Some medicines can affect bleeding, bruising, or healing, but medication decisions should always be reviewed with a qualified healthcare professional. This is especially true for blood thinners, steroids, diabetes medications, or any medication prescribed for a serious condition. The safest step is not to stop anything suddenly. The safest step is to ask. A slow healing cut is not a diagnosis. It is a clue. Sometimes it is simply aging skin doing what aging skin does. Sometimes it is a small reminder to protect your skin more carefully. And sometimes it may be connected to blood flow, blood sugar, nutrition, infection, or another health issue that deserves attention. The key is the pattern. One small cut that takes a little longer may not mean much, but repeated slow healing, wounds that worsen, wounds that do not close, or wounds on the feet in someone with diabetes or poor circulation should be taken more seriously. Healthy aging is not about worrying over every change. It is about noticing changes early enough to respond wisely. So the next time a small cut seems to linger, do not immediately assume the worst, but do not automatically dismiss it either. Ask a few calm questions. Is it improving? Is the redness shrinking? Is the pain getting better? Is there swelling, drainage, fever, or spreading warmth? Do I have diabetes, poor circulation, or reduced sensation that makes this more important? Those simple questions can help you decide whether it is something to monitor or something to discuss with a healthcare professional. The main lesson is this. After 60, healing can slow because the skin, blood vessels, immune system, and repair process all change with age. But slow healing is not always just aging. It may be one of the body's quieter signals. And when you understand that signal, you can respond with awareness instead of fear. This video is for education only and does not replace medical advice. If a wound is getting worse, not improving, or showing signs of infection, it is worth contacting a qualified healthcare professional for more calm, clear explanations about health after 60 and the body signals that are easy to miss. Consider subscribing, because the more you understand your body, the better prepared you are to take care of it.